Let's now look at a few important considerations regarding the measurement of health from a public health perspective. Here in this slide, you can see that there are 4 columns that depict both the years of healthy life and the total life expectancy, starting in the left for all persons, and then in the remaining 3 columns broken down by race. So what is important to me when we consider this kind of data, or these kinds of data, is the gap. So first off, for all persons, it is not unexpected that when we look at a person's lifetime, all of their years are not necessarily in a state of health. So there's this gap. You can see 65.2 compared to 76.7. However, when we begin to look at vulnerable populations, the gap perhaps widens a bit. If we look at Hispanic individuals living much longer, 82 years, but of those 82 years, only 66 considered to be healthy life. So that is a lot of suffering by individuals that is not perhaps considered fair or reasonable compared to the gaps that exist for other individuals. So whenever we look at numbers, we always want to think about what might we be able to find if we were able to get more granular or more focused data. This next slide, in terms of measurements of health, goes to the determinants of health. And while this slide, while the important pieces are not the exact numbers, it's really the relative percentages that these factors contribute to health or well-being or to a disease status. So the biggest take home is that behavior and lifestyle contribute greatly to the health and well-being of individuals and determine whether or not a person may develop a disease. You can see that genetic composition is still important. Most people say that genes are not destiny, but they clearly can be an important part of the determinants of disease. Environment also can play an important factor, and that probably should not be surprising after we've considered all the social determinants of health that impact health and well-being. And then lastly, you can see lack of access to medical care is a smaller percentage, and I think that this is the component that often strikes people as surprising. But one thing to remember is when someone gets sick or ill, what percentage of the time are they actually going to see a physician, even if they have that ability? It turns out that it's actually the minority of the time that they actually need to go see a physician. So even if they want to go see a physician, if there are problems with access, we can readily understand that lack of access can lead to poor health outcomes and more rapid development of disease if gone untreated and uncared for. So measurements of disease, we also always want to think about what are the determinants. And this slide really combines much of what we've talked about. We can see in the left-hand column the leading causes of death in 2000. In the right-hand column, what is really interesting is this take-home point from the previous slide about the role that lifestyle and behavior plays in determinants of disease, and in this slide, the actual causes of death. So you can see tobacco, physical activity, poor diet, and alcohol consumption are the leading behaviors that lead to death, not directly necessarily, but through the disease states that are associated with tobacco use, that are associated with poor diet, with physical activity, with alcohol consumption. So when we think about those chronic diseases, when we think about heart disease, cancer, stroke, lower respiratory infection, and unintentional injuries, each of those have associations with tobacco, poor diet, physical activity, and alcohol consumption.